Okay, so as I was saying before that example of when your energy runs out, apparently we lost some sort of power. So perfect timing for what we're talking about. If you utilize if your energy is being utilized mostly for digestion, you may not have enough energy for optimal functioning of your immune system. So that's why, when you're eating fruits and vegetables, it goes through the GI tract a lot faster. It doesn't take a lot of energy to break down those foods. Good protein source instead of red meat, or instead of meat in general, would be beans. Beans are a good source of protein, and they get broken down fairly quickly in the GI tract because they don't have a lot of fat associated with them. Sleep, again, is restorative. Sleep allows your immune system to be enhanced, optimized, if you will. A good night's sleep is very important for the immune system. Okay. I want to thank that gentleman again from Tennessee, I believe. He's right. I didn't mention sleep. Had mentioned it before in my defense, but just not in that video on Friday. There's something out there called conspiracy theorists or conspiracy theories. And I disagree with that term. I disagree with it because I don't believe we've had appropriate leadership with regards to the pandemic. And when we didn't have, or we don't have appropriate leadership or shared knowledge about what we know and what we don't know and what we're trying to understand, it leaves a vacuum or a gap for people to put in their opinions. This cabinet, I don't know if you can see it if I open it, this cabinet is tan. No conspiracy theorist can tell me that it's black. It's tan. There's no question about it. There's no room for opinion. It's just what it is. Light brown, tan. But when you have something that science can't explain completely, there's room for opinion. And sometimes that opinion becomes fodder for social media to run away with. I think we had better medical leadership in this country. I don't think people would have to make up things to sort of fit in to try to understand what we don't understand. So for all those who are trying to come up with novel ideas about why we should or shouldn't wear facial coverings, or novel ideas about where this virus came from, and what the government's role is, and what the politicians' role is, and what foreign countries' role is or was in this virus, I get it. Information is lacking. I think all along the purpose of these videos that I've been doing, I think it is 4 or 5 weeks now. Anybody? Yeah, I get a bunch of yeses. Okay. The yays have it. 4 or 5 weeks. The purpose has been to give you clear information of what is known. What I know is the information that is available at this time. the, the information that is available is not a huge amount. What we do know is, once again, we have a respiratory virus that has no vaccine yet, so we can't prevent it, has no treatment yet, except if you're in severe case of it and hospitalized. But we don't want you to get there. What I'd like you to do is never get there. What I'd like you to do is understand that we have known for hundreds of years that if you want to stop the spread of a virus or a pathogen, you cover your mouth. I mean, look at back pictures from 1918 during the flu, pandemic. There's pictures of people wearing facial coverings. They knew 100 years ago to wear facial coverings. Eventually that virus got controlled in one way or another, and there's different theories about that. And that's not what this video is about today. I don't think there are conspiracy theories going out there. I think there's opinion. And although those opinions may not be correct, they seem to be backed up by followers, and it's for the same reason. What I'm going to tell you is exactly what I know. Respiratory virus, no vaccine, no treatment, facial coverings decrease the spread. Facial coverings do not stop the spread. Facial coverings decrease the spread. If you wear an appropriate facial covering, you're in no danger of getting ill from a facial covering. If you wear a surgical mask or cloth covering that's breathable, that you can breathe in and out of, you're not in danger of what you're hearing on social media. If you don't wear a facial covering, you're putting yourself in a small amount of danger from getting sick, but you're putting other people in a lot of danger if you're a carrier. We know that there are about 100 vaccines in trial. We know that the vaccines are targeting different parts of the virus. We know that there are about 80 medications in trial. Those are things we know. The thing that I know as a physician is, if you want to learn more about what you can do to prevent yourself from getting ill, other than what I'm telling you, talk to your doctor. If I'm not your doctor, talk to your doctor. This is in the media, it became political. This is not, doesn't need to be political. This could be between you and your doctor on how to prevent you from getting ill or how to treat you if you are ill. This is not something that has to be discussed to the length that it is on social media. This could be a very personal issue between you and your physician. It's not conspiracy, it's unknown. And it's people trying to come up with an answer for things that we don't have an answer for. So forgive them. They're trying. They're using their brains to try to figure it out. It's just that sometimes it goes the wrong way and some people get hurt by that information if people start listening to it. All right. So putting it all together, it's a privilege to take care of you. It's a privilege to be your doctor. It's a privilege to do these videos. I look forward to continuing on them. Thank you very much for those kind comments about the Wellness Center as the construction is, hammers and swords are starting to go. The wellness program is going to be an adjunct to an already established practice that I have. Had a question from a patient asked, will I still be seeing patients? Of course I will be. I'll still be treating runny noses, and I'll still be treating hypertension and hypercholesterolemia and diabetes, but I'm going to be doing it along with the regular practice. I'm going to be doing it with a wellness program as well, because it's not all about always taking a pill for everything. Sometimes it's about learning how to eat better and learning how to exercise better and learning how to improve that immune system. And I'm not going to be able to do that completely with a pill. And I know that, and you know that. And that's why I hope we're both hungry for an alternative source of treatment and prevention. The Reisig Wellness Center. Have a wonderful evening, everybody. I'll see you tomorrow.